Hi, I'm Dr. Gino Marcovici. For people facing pattern hair loss, the choices can be daunting. I'd like to talk today about the advantages and disadvantages of the most common choices available to treat pattern hair loss. The first approach is to do nothing, letting nature take its course. The advantage is that one is not investing in a treatment plan or technology, one is simply letting nature take its course. The disadvantage of this approach, of course, is that one continues losing their hair. The second approach is to use non-surgical means to apply hair in some fashion to the scalp. This is called a hair system, hair replacement, hair weave, whatever we choose to call this. It's basically artificial. The advantage of this approach is that the results can be instantaneous and initially look quite good. The disadvantage is that because this is not living, growing hair, it will deteriorate over time. Another significant disadvantage to artificial hair replacement is that because the base unit needs to be applied to the scalp in some fashion, the unit can cause hair loss in the wearer's scalp. So you can actually accelerate the degree and severity of the hair loss simply by wearing an artificial hair replacement system. The next approach is surgical hair restoration, also called hair transplantation. Some people use large pieces of hair-bearing tissue, some people use small pieces of hair-bearing tissue, but the net result is moving viable hair from the back of the scalp, where it grows forever, to the front of the scalp where it has fallen out, where it has thinned, or the hair has gone bald. The advantage of this approach is that the hair that is transplanted remains viable and grows forever. The disadvantage is that in the wrong hands, the results can be highly dysaesthetic, can look artificial, can look like you've had a hair transplant, which is the last thing that most people seeking restoration of their hair would like to have. The next option after this is medical treatment, and there are three primary drugs that are available to treat hair loss. The first is ROGAINE, which is topically applied minoxidil. Minoxidil was initially used as a blood pressure medication, and when taken orally, one of the side effects that was noted was that hair grew on typically non-hair-bearing sections of the body, the face, the arms, and so on. Topical minoxidil was tested on the scalp, and it was found that in a reasonable percentage of people, some hair grew. The advantage of minoxidil is that it's a fairly non-invasive treatment option. The disadvantages are that it is a drug, there are potential negative side effects, and if the treatment is discontinued, then the results are also discontinued. The next drug that is available is finasteride or PROPECIA. PROPECIA is a different drug, a different class of drug than minoxidil, and the drug finasteride actually blocks the conversion of the primary androgen hormone, which is testosterone, into a metabolite called dihydrotestosterone. Dihydrotestosterone is the androgen hormone primarily linked to pattern hair loss. Finasteride is an oral medication. It must be taken continually in order to enjoy benefits, and there are also side effects noted with the use of finasteride, the use of PROPECIA. The final option that is available is non-drug therapy, alternative medication, alternative medicines. And recently, a lot of naturally occurring substances have begun to become tested for their potential medical benefit. One such compilation is HairGenesis, which is based on naturally occurring substances that have shown the ability to inhibit the onset and progression of pattern hair loss. HairGenesis was tested under FDA-regulated, IRB-monitored, placebo-controlled, double-blind conditions and demonstrated positive results sufficient that they were published in the peer-reviewed medical literature. So These then are the options that are available today to treat pattern hair loss. The one thing that we strongly recommend is that a person who is considering treatment options become as educated as possible. Learn as much as you can about the options that are available, involve your treating physician, and take your time. Don't let anyone rush you into making a decision one way or the other. An educated consumer is generally a happy consumer.